Hello, I'm Dr. Surindher. I'm the Director of Cosmesis India. We are a cosmetic and aesthetic surgery center in the heart of Bangalore on Brigade Road. When we talk about liposuction, there is the next question which comes in is what is the recovery period? So recovery, there are two forms of recovery that we talk about when we talk about recovery from surgery. One is the initial recovery, that is how soon can you get back to work or your normal activities and you overcome the surgery part of it. And then of course the full recovery, that is when all the healing is complete and you're back to normal as how you were before. Short term or that early recovery phase, that is just a recovery from the surgery part. Most of the times liposuction, unless you're doing a large volume liposuction where you're removing more than 10% of your body weight, usually you can get back to all your normal activities within 2 to 3 days time, depending on the areas done also. For example, the abdomen and the trunk is easier. The thighs and the buttocks or the hips are a little more difficult to get back to work. But even in the worst case scenario, 3 to 4 days is what we normally advise when you can start getting back to work and doing your normal activities. Of course, you will have to wear a garment inside after the surgery, which you do wear, and that will prevent your swelling from getting too worse. All the discomfort post liposuction when you're doing all your normal activities or otherwise is because of the swelling. The swelling, if it is kept in check with the help of your pressure garment, then you are able to function much better and you can do all your normal physical activities, including going back to work. But of course, we tell them that you shouldn't be confined in one place for too long. You should get up and walk in between, sit straight and keep yourself hydrated. And of course, you have to wear the pressure garment. Now, when we talk in terms of a complete recovery, that is usually takes about 3 to 4 months. When you're talking about liposuction, immediately after the suction, the day of surgery, you can see the result because there is no swelling or edema as we call it. So you can see the results, but in the next 24 to 36 hours is when the swelling is coming in. So that is when your swelling is increasing and it peaks at around the third day. From third day onwards, everything is going to start going down. So that is why we say when you're talking about suction, so after the third or the fourth day, you're able to start doing all your normal activities. You can shower, you can get back to your normal work. Discomfort wise, you wear your garment, you're on medication for the first week or 10 days. So that takes care of the pain and the swelling. And the swelling, when we talk about the swelling, about 50% of the swelling or 60% of the swelling is gone within the first 2 weeks. And then the remaining 30 to 40% takes another 2.5 to 3 months. So when we talk about swelling, it is not visible physical swelling for others to notice, but for you to feel normal. When, for example, when you touch yourself, you feel that your skin is soft and supple. When you're after the lipo, because of the swelling, it is going to be hard. It is going to feel lumpy. It is going to feel dry. And those are the things that we talk about as recovering or swelling when we talk about swelling post lipo. So for all that to be gone, for the skin to get back to how it should be and for everything to soften and your skin to come back to normal, it takes about 3.5 months. And that is why post lipo you have to wear your pressure garment and you have to do some massages, you have to do some exercises and all that, which we tell you to start from about 10 days onwards to about 3.5 months is the complete healing. So, and you can start your exercises in normal routine. Usually if it's a lipo, you can start in about 10 to 12 days time. Of course, graded manner according to what your body can handle and according to how much volume has been removed. But that your surgeon will always tell you.